All right. So let's get started. Thank you again for joining us for our presentation. We're talking a little bit more about and exploring why bioethics and medical humanities can enhance your future. So I'm going to go ahead and have us dive right in. So I am Leah Jeunnette. I am the director of our MA in Bioethics and Medical Humanities program here at Case Western Reserve University. I am also the Associate Director of Educational Programs and a Senior Research Associate in our department. I'm also a clinical ethicist at university hospitals, which means I get involved with patient cases and different ethical issues as they go on in the clinical setting at UH. And I was very excited to, put this on the slide deck. I am a 2009 alum of this program. So I graduated from the master's program back in 2009. So it's really very full circle to kind of be on this side of things. So I'm going to talk just briefly about Case Western Reserve and our School of Medicine, and then we're going to dive into why study bioethics and medical humanities. We'll talk about how an MA program or a master's program can enhance your future. We'll talk specifics about in the overview of our MA program, application and financial aid, and we will leave time for Q&A at the end. So regarding Q&A, we are using the Q&A feature here on Zoom. You can go ahead and click on the ellipses to get to the Q&A feature or click right on the Q&A feature. Feel free to submit your questions at any point during the presentation. I will save them to the end, but feel free to submit whenever a question comes to mind. And if you are watching the recording, you are welcome to send questions to bioethics@case.edu. We'll have that email at the end as well up on the screen. So let's talk a little bit about Case Western Reserve University. So we are a research-focused university. We are located in Cleveland, Ohio, right along the Lake Erie. Very fortunate to be located where we are. We're quite a large city, but also have really great cost of living, which I think makes us stand out. Case Western Reserve University is actually celebrating 200 years. Our bicentennial will be next year, so it's really exciting as a community to celebrate together. Our Department of Bioethics and our MA program are located in the School of Medicine. There's all different rankings for universities and schools of medicine, just to kind of highlight a few things. So we are considered a top tier medical school in the United States, and we are also ranked #1 in Ohio. In terms of research impact, our School of Medicine is quite research active, and so we are #7 in the US, #22 in the world, according to the Leiden Impact Rating. And according to the most recent, the 2024 report from the Blue Ridge Institute, we are 26 in NIH funding. The other thing I want to highlight, though, when it comes to our research and how it affects our education and opportunities, is we are not just a school of medicine. We have 8 schools in total at Case, between our College of Arts and Science, our law school, our business school, dental, nursing, and so on and so forth. It allows for us to have wonderful collaboration across the university, and it allows us to have collaboration in the research space and educational space across our healthcare systems. And so we have 4 wonderful teaching hospitals here in Cleveland, which I'll highlight a little bit later. But we collaborate with them on education and research initiatives, which makes Cleveland and Case Western Reserve a wonderful city to be in. So let's talk just briefly about why study bioethics and medical humanities. I think the most obvious place to start is that healthcare impacts all of us, whether it's our own healthcare, the healthcare of our loved ones, or it's the field that we have a profession in or want to have a career in someday. Healthcare impacts all of us. And so I often am talking to students, and some students, are interested in going on to medical school, and they may say, I think it's going to help me be a better doctor. And I say, you know what? It's going to help you be a better medical student, a better resident. It's not a matter of if bioethics and medical humanities issues come in your path, it's when. And often it's much earlier than people realize. And I think that's important to recognize. One of the big things I think that makes bioethics and medical humanities so important to study is we have constant advancements, technology, research, science. All of these things are what we can do or what we could imagine doing or attempt to do. but they lead to big questions that ultimately are ethical and humanistic concerns. So questions like, should we intervene? Is this something that we maybe shouldn't intervene? What kind of values should inform policy or practice? And questions like, can we and frankly should we ensure justice and respect for persons in research and or clinical practice? These are really tough questions to address, and it depends on the case, depends on the scenario, on the parameters. It depends on who's at the table of how we even attempt to answer these questions. But these are still big questions that have to be answered. And sometimes they're small answers because it's a small question, it's a small situation. And other times we're talking more systemic and large scale. And it's going to take a lot of effort to answer those questions in a more cohesive way. So, for students that do come to bioethics and medical humanities, it is an incredibly interdisciplinary and multidisciplinary field. And so we see students from across all of academia and their undergrad majors. This is just a small sampling of some of the recent majors that have been from our students, but I think it speaks to the interdisciplinary nature and the lens that a student is bringing to the table, or the expert could be bringing to the table in a discussion. And I think it's really important to recognize that when you're answering questions about policy and practice, you could be sitting next to someone that's coming at it from a very anthropology focused lens, and the person next to them is coming from a neuroscience lens, and the person next to them is coming from a political science lens, and so on and so forth. And I think it's really important to kind of think about that as you consider, is bioethics and medical humanities a potential area of focus for me, even if it's in the short term. So then how does it help a career path, right? If we go from here's the majors that we see students have that are interested in bioethics and medical humanities, how does it get them in? How do we think about career paths? So ultimately, because it's interprofessional and multidisciplinary, interdisciplinary, we see students go on to a myriad of professional careers. That could be clinical or legal professions, physicians, nurses, chaplains, social workers, lawyers that are for hospitals or for private practice or for nonprofits. We see people go into regulatory work, actually working in research or working in regulation or working in the government or working for lobbyists to help change policy. We see people go into arts and humanities. We have students every year that want to be full-time bioethicists or clinical ethics or other areas of academia. And we also have a segment of students, which I think is really unique and something our master's program, but also bioethics and medical humanities as a field lends itself really well. And that is discernment for the undecided. And there are always students who will say something like, I'm interested in healthcare, or I'm interested in policy, or I'm interested in fill in your profession here, but I'm not sure exactly what that career might be or what the path to get there is. And a field like bioethics and medical humanities, because it's interdisciplinary, interprofessional, allows for the opportunity of discernment, of really kind of diving into what is possible and what can I imagine and what others have gone before me to open doors and to think creatively about my career path. So then how does a master's program like ours more specifically enhance a student's future? And so I just want to highlight a couple of things. We will dive into this a little bit more when we talk about the overview of the MA program in total. But things like customized curriculums are really important, right? It's not sending you on one career path, but the customized curriculum allows you to consider, can I go in direction A, direction B, or direction C? And yet all three of those students are sitting in a classroom together. It allows you to choose electives that are going to support your career path and the future you're envisioning for yourself. It allows you something like 160 hours of clinical experience, which gets you to explore career options and understand ethics in the hospital and at the bedside. It gives you training in interdisciplinary and multidisciplinary education. So what does it mean to have a anthropological lens or a literature lens? Or what does it mean to come to think about socioeconomic factors or cultural factors, or focusing on social medicine versus medical humanities, or thinking about different theories and approaches in these fields as well. It also is going to lend itself, so to enhance the future, is to look for opportunities in research, teaching, and administrative experience. Beyond the classroom, what opportunities are there? And I think that's really important when you're looking to enhance your future. Ultimately, students go on to a myriad of career paths from our master's program, and this is what excites me. Again, this is just a small sampling of places that our master's students go. And it could be that from our master's program, they go on to medical school or law school or a PhD program. And then these are the careers they end up in. It's a fantastic way to kind of visualize, think about all the minors that we saw, and now these career paths. And so it is wide and diverse, and I think it speaks well to the strengths of our master's program and ultimately the field of bioethics and medical humanities. So let's talk a little bit about our MA in Bioethics and Medical Humanities program. So this fall of 2025, we are celebrating our 30th year of our master's program. That's an incredible number, and we are one of the oldest master's programs in bioethics in the country. In 2017, we formally added the and medical humanities, but our program is celebrating 30 years, which is incredible. It also means we've been able to slowly and intentionally grow our program over 30 years. And so we give students a lot of opportunity, and we do these things well because we've been intentional about our growth over 30 years. For students who complete our program full time, it's typically done in 1 year, ultimately 2 semesters, although some do take 3 semesters, fall, spring, summer, perhaps. But most students do fall and spring. We have a customized curriculum for our 30 credits. So 13 and a half credits of elective are just purely elective. The rest are core requirements, but there still is flexibility in what you're looking at within those core courses as well. We offer 160 hours of clinical ethics rotations. I will talk about rotations in a few slides. We also offer short-term study abroad immersion programs, so 1 or 2 weeks of intercultural examination of bioethics and medical humanity issues, and that includes traveling to those locations. And we have 3 concentrations in our program: research ethics, medicine, society and culture, and health policy. Now, students are not required to do a concentration. By default, all students are in what we label as our traditional program. But for students who are particularly interested in research ethics, medicine, society, and culture, or health policy, they are welcome to dive into those concentrations. All students receive personalized advising in our program. We try to match you with an advisor that is in an area of interest that you may indicate on your application. And we do have dual degree options for our medical degree, our law school, a master's of public health, master's of social work, master's in genetic counseling. If you are interested in any of those dual degree programs, feel free to reach out to get more information about the specifics of that dual degree. And ultimately, you need to apply and be accepted to each program, each of the dual degree program, independently and separately. So when it comes to our customized curriculum, all students take Foundations in Bioethics and Medical Humanities 1, Foundations in Bioethics and Medical Humanities 2, and they take 1 semester of clinical ethics rotations in the fall, and then in the spring they do have a capstone to write, a 23 to 25 page paper. That capstone, students get to pick the topic that they want to write about and they want to do research in. And that's really exciting for students. And also they identify a faculty reader who can come alongside them and help mentor them in that writing process. By default, all students are in this first column, what we call the traditional program, meaning when you look at the electives, they are fully open to students: elective 1, 2, mini elective, and then elective 3 and 4. And they complete a 2nd semester of clinical ethics rotations, getting them to 160 hours. If you're interested in one of the concentrations, medicine, society and culture, health policy, and research, some of these electives are pre-designated. So for instance, elective number 1, each concentration has its own core course for 3 credits that the student needs to take. Their mini elective is also designated ahead of time. And then for health policy and research ethics, instead of their second semester of rotations, they will actually complete a practicum, which is more of a project-based initiative focused on something related to either health policy or research ethics. They still, though, have some elective opportunities to be able to customize the curriculum a bit more based on their interest, even within their specific concentrations. So, clinical ethics rotations, I think, is the number one reason that students choose our program. It's an amazing opportunity that we have had built into our curriculum since the beginning of the program. So, here in Cleveland, we have four major teaching hospitals that all have direct affiliation with Case Western Reserve University, as well as our Department of Bioethics. So, University Hospitals and Cleveland Clinic are the two private hospitals in Cleveland. University Hospital is the largest a primary care provider, but they also do things like pediatrics. They have a large pediatric hospital called Rainbow's Babies and Children. They do neuro care, they do cancer care, they do transplants. Cleveland Clinic is probably the most well-known coming out of Cleveland. They are number one in a myriad of specialties, including cancer care, OBGYN care, urology. Um, Metro Health and the VA are the two public hospitals in our region. Metro Health is the county hospital. It is the safety net for the region. And so in addition to trauma care, fantastic emergency care, they also have a burn unit, as well as serving the uninsured or the underinsured in the region. And we have our Lewis B. Stokes Cleveland VA Medical Center, which is a part of the VA administrative hospital system. Our VA hospital here in Cleveland is actually the fourth largest VA hospital in the country. We are fourth behind, I believe, New York, DC, and Seattle. So it's a pretty extensive network of hospitals here. When you're in these rotations, each semester you are assigned to a particular hospital. So the goal is to get you at one public and one private if you're doing 2 semesters. The idea is that in that given semester, you are going to different morning rounds in ICUs, on the floors, going to interdisciplinary team meetings. You're going to different committee meetings like ethics committee, animal research meetings, transplant selection meetings. These are committees that meet to decide if someone is eligible to be listed for a transplant. And the committee focuses on a specific organ. So you might have a lung transplant selection committee, and there's a different committee that does kidneys. There's a different committee that does heart, and so on. You also have the opportunity to go one-on-one with healthcare professionals as they visit patients, they attend meetings, and really kind of see where a physician, a chaplain, a social worker, a genetic counselor, a nurse, interact with ethics in their day-to-day work. And I think this is an incredible opportunity. On a weekly basis, in these rotations, you get together with fellow students who are rotating at the hospital site you're assigned to, and a clinical ethicist from the hospital. And it's an opportunity for an hour to kind of digest, discuss, and debrief the ethical issues and cases you have seen throughout that week. Students really love this because the goal is to receive both depth and breadth in these rotations across the system. And it's not just looking at clinical ethics, but you're also looking at medical humanities, socioeconomic issues, legal issues, cultural issues, religious issues, you name it, it kind of comes up in these rotations, which is incredible for students. I mentioned earlier we have bioethics study abroad courses. These are 1 to 2 week courses that focus on bioethics and medical humanities issues. We have courses this upcoming spring going to Paris for 1 week in May and Granada, Spain for 2 weeks in May. We are looking to 2027, in addition to the Paris and Granada course, potentially launching a Birmingham, England course over spring break and potentially reviving a course to the Netherlands over spring break for 2027. What I love about these courses is they are incredibly interdisciplinary. So these courses, the majority of students who end up enrolling these are actually outside of the Master's in Bioethics program because we include all students across the university or the campus, undergrad, grad, professional students. And so you end up with a really dynamic group going on these study abroad courses. If you are interested in applying to the program, we are currently taking applications. It is an online application. We ask for unofficial transcripts for the application process. You will need to submit official transcripts if you're admitted and decide to enroll. We ask for a CV or your resume, 2 letters of recommendation, a statement of purpose. Graduate test scores are technically optional for our application. We have found that while graduate test scores are welcome to be submitted, we do not require them. If you are an international student, there may be an English language requirement. It depends on where you received your undergrad education, and if there is a transcript evaluation needed. And if you are a current Case Western Reserve undergrad and you're interested in our combined bachelor's and master's, you'll need to submit a PPOS form. And I can speak more directly to the CBM applicant when it comes time about that form. In terms of finances, we have something called student assistantships that we offer. Anyone who applies to the program is eligible to apply for our assistantships. It's an opportunity for students to be plugged into teaching, research, or administrative opportunities. That could include joining a research project or helping with an undergrad course in our department. Anyone who submits an MA application will receive the link for that starting in January, and then going forward with usually within 48 hours of submitting an application, you'll receive the assistantship application link. We also have traditional financial aid models available, which you can look more online from the financial aid office, as well as tuition information available through Graduate Studies. In terms of a timeline, we are currently taking MA applications for fall of 26. Our priority one deadline is coming up December 1st. If you are interested in this priority one deadline, we would need a completed application by December 1st. That includes letters of recommendation being submitted. And then what happens is, as long as we have that completed application, we will guarantee a decision, an admissions decision to be rendered before we go to winter break. And so that gives us a little bit of time to review the application, interview the applicant, and then ultimately render our decision. If you are interested in CBM fall start, March 1 is the deadline. Our priority 2 deadline is May 15th. That deadline is important if you are interested in applying for a student assistantship. The application for the assistantship is due June 1st, but if you want to be eligible, you need to submit a master's application by May 15th. Ultimately, our final deadline for a fall start is August 1st. We have orientation at the end of August, and then August 24th, 2026 is when fall classes start. I will say 2026 is just around the corner, and if you're interested in applying, I recommend applying early. We do rolling admission. And once we have a completed application, it takes us 2 to 3 weeks to render an admission decision. We keep this moving quite quickly so that students have the opportunity to make decisions in a timely manner to enroll in our program. I'm going to open this up to questions. If you are live with us, you're welcome to submit things in the Q&A feature here on Zoom. If you are watching the recording, please email bioethics@case.edu. I'm the one who primarily checks that email, and so I will respond to you usually within 24 to 48 hours. If you are interested in scheduling a one-on-one meeting with me, you can either email, again, this email address and I can send you the link, or you can scan this QR code to set up a meeting. I think what's important about a one-on-one meeting is it allows students or applicants to talk directly with me about their career path ideas, their situation, to see if this program is a good fit for them, if our goals will line up with your goals, and to look for mutual fit. I think that's a really helpful thing. It'll also help make you more confident in the application process, so you'll have a better sense if you'll be admitted to the program. I meet with students on a regular basis, with prospective students, with applicants on a regular basis, and I highly encourage you, schedule a one-on-one meeting with me. I'm happy to meet with you and talk about your situation. So I'm looking to see if there's any questions submitted. There is one about application fee waiver. We do offer that. I would encourage you to email us, bioethics@case.edu, and we can provide a fee waiver code for you directly there. So thank you for that question. As other folks are typing, I will say one question we often get is what helps, or what would we say helps our program stand out compared to other bioethics and medical humanities programs across the country or around the world? And I will say, as the program director, as an alum of this program, I'm a little biased to answer that. So I actually want to quote a colleague of mine who answered this question really eloquently because I believe it gives a much more objective perspective. We have a great colleague who is in the Department of History here at Case Western Reserve. His name is Dr. Jonathan Sadowski. Something he said to me that stood out was that he believes that a program like ours, one of our strengths is that we have both breadth and depth. Because we have 30 years of history, we have been able to grow the program breadth-wise, meaning we have 3 concentrations, we do clinical rotations, we do study abroad, we have a lot of elective options for students, from history courses to death and dying, to aging, to neuroethics, to genetics and ethics, to adolescent health in the court courses, to courses on disability, to courses on philosophy. And it allows for both depth and breadth across our program. And I think that's really special about us because we've had 30 years to do this. I do see another question came in. Is an interview part of the application process? It is. We interview every single person who applies for our program. We conduct those on Zoom. Typically, they're about 30 minutes. Once we receive the completed application, someone from our admission committee will review the application, and then another member of our admissions committee will schedule an interview with the applicant. And then once those 2 decisions are submitted, if both individuals recommend admission, we would then notify the student regarding their admission status. And so, yes, we interview everyone for the program. I also think it helps for students to understand a little bit more about our program through that interview process. So thanks for the question. There's another question. What is the specific content that is taught in the health policy class? That's a great question. So I will highlight a couple of things. One, Dr. Sana Liu is our concentration director for health policy, and she oversees the curriculum in those particular the concentration courses. She has a wide variety of background, from history to social work to psychiatry to education to theology and epidemiology, anthropology. And so she brings all of those to the table when it comes to health policy. I think one of the great ways that she has described her classes is that one specific thing is that it's not just about policies that are written in relation to health. It's also about policies that affect health. I think a great example is she will talk about policies around mental health care, right? You can have policies that address mental health care, mental health ethics, but you also can have policies that affect mental health, that affect these patients, right? They may be policies in immigration or housing or you name the area, but they ultimately have an effect on health as well. And so the first course you take focuses on formulation and analysis of policy. So how are policies made? Who is at the table? What is best practice? How do we analyze policies that are out there, critique them, provide feedback? And then your second course that you're going to focus on are cases in health policies. So what specific areas and cases come up that need to be focused on and get an intense focus and dive into a particular case that is well known. So really interesting opportunity. So great question. There's another one that says, what qualities do you look for in strong applicants? Great question. So we look for, I think, number one is mutual fit. So are you interested in bioethics and medical humanities? How are you envisioning it to enhance your career path? How are you hoping to utilize it? You don't have to be a full-time bioethicist or medical humanist or clinical ethicist, but how are you hoping it's going to enhance your future or your career or whatever it might be? I also think we look for applicants who have strong backgrounds in humanities. Now, that is not to say we do not have prerequisite courses. We do not require any specific bioethics or medical humanities course. But on your transcript, in the courses you've taken, we look for, did you take English courses, history courses, maybe a philosophy or a psychology or a sociology or bioethics or political science? Did you succeed in those courses? Were you getting strong grades? Our program is reading and writing intensive. It's different than a STEM focused program. And so, is your transcript indicating that you have a strength in reading and writing courses? Can you do well in a program like ours? I also think we look for students who understand the value of the bioethics and medical humanities education. I think that's important. There's another question. Does the bioethics program offer courses that explore neonatal and pediatric bioethics specifically? Yes, we have had courses in the past and we will have courses in the future. So I will say first off, in our Foundations in Bioethics and Medical Humanities 1 course, that course is broken into 4 units. Unit 3 focuses specifically on pediatric ethics, so neonates, babies, children's, adolescents. I specifically oversee that unit, and so we really do a very high-level comprehensive overview of the bioethics issues in neonatal and pediatrics. We have offered courses focusing in on pediatric ethics, on adolescent health. We have a new course launching this upcoming spring about children and adolescents and their interactions with the court system and what ethical issues and humanistic issues and cultural issues are at play in those situations. We have courses that focus in things like queer bioethics, which also have a pediatric component to it or an adolescent health component to it, as well as courses focusing on research ethics or death and dying, which again, mental health ethics, which will have discussions relating to pediatrics, adolescents, because just because you're talking about a particular area doesn't mean neonates or pediatrics aren't a part of that discussion as well. So I hope that answers your question. So we are at time. I want to thank everyone for attending this webinar. If you think of more questions, feel free to email or schedule a one-on-one meeting with me. I'd love to talk to you one-on-one about your interest in the program, the opportunities, and if it's a good fit for you. Thank you so much again for your time, for those that are here live and for those who are watching the recording. I hope everyone has a great rest of their day. And thank you so much. I hope you take care.